Welcome. Welcome to the side event on shock responsive social protection, lessons from the Joint SDG Fund on integrated approach to COVID-19. Thank you very much for taking the time to join this session. We'll jump straight into it because we have 1 hour and we have a lot to cover, and we'll provide a lot of opportunity for you to engage as well, because the whole session will be divided into 2 parts. The first part is a short introduction about the fund. Then 3 joint programs from 3 countries will be presenting the highlights of their work. And then the second half will be devoted to the panel discussion, which will be based on the questions that you will ask us. So let me start with the presentation. You have some of the social media information here about the Joint SDG Fund, and also you have the hashtag of the overall conference, so feel free to use those. And at the end, I'll also share some of this information for the conference overall. So we'll have, my name is Dana Drava. I'm head of program at the Joint SDG Fund. And I will be our moderator today. I will also answer some of the questions that relate to the Global Fund overall, that are not specific to a particular joint program or particular country. We have 4 of our colleagues who will be panelists and presenters. I will call on them to introduce themselves briefly when they start speaking, but we have, just to let you know, they come from 3 different countries, or actually 3 different joint programs, one of which cover more than 1 country. And these are among the joint programs that the fund supports in the area of shock response and social protection. So since I mentioned this, I'll just jump into the presentation of the fund, but I would like to ask you to post the questions in the Zoom Q&A option. You can find it below if you are not so familiar with Zoom. So you click on it, you post your question, and this will then help us use it to guide the conversation. You can also use chat, but chat is a bit faster sometimes, so your question may be lost. So if you really want to make sure your question is being asked, put it into the Q&A, but use the chat to ask, maybe more specific, brief questions, and we'll also use it to provide more information when needed. Beside me, there is my associate, Mark Filipovic, who is going to be supporting us, and then Marina from the organizer side, who is making all this possible. So I'll briefly present the key information about the fund, and just to let you know that we'll make the slides available in the virtual expo booth. So when you go to the conference website, there is a virtual booth tab. You go there, you find Joint SDG Fund. We have more information there. We have also a fact sheet on the shock responsive social protection joint programs. But this is where the slides will be uploaded shortly after this session. So there's more content in the slides that will be presented. So this is for you to know that you can go back, check them out, and see more, on your own time. You can check the content more carefully. So the Joint SDG Fund is a new global fund. We were launched less than 2 years ago. It's a fund with large ambition. It's the only fund that basically is owned by the whole UN system, so 40+ agencies, funds and programs of the United Nations own the fund, so to say. It's led by the Deputy Secretary General of the United Nations. And this is large in the ambition because it is meant to be doing something really challenging, which is to support the acceleration of the progress on the Sustainable Development Goals, the SDGs, and also to incentivize the ongoing reform of the UN development system. So among other things that we do, we have a portfolio on social protection and leaving no one behind. This was our very first portfolio based on 114 countries who made initial proposals, and we selected the top highest quality 35. So we have 35 joint programs. We call them joint because they are implemented by multiple stakeholders in an integrated, coherent manner. but in 39 countries. So we have some country offices, country teams that have more than one country, like in this case, Barbados covers more than just country of Barbados. The overall funding is $102 million, 70 of which the fund provides and the rest is co-funding. The approach is to invest into systemic transformational approach. We are asking all the joint programs to deliver a result at scale in just 2 years, so by 2022. But that's going to be possible by applying a catalytic approach. So you invest into very strategic entry points that hopefully then create this chain reaction or catalytic effect across the broader system. And they also work a lot on innovation, focusing on the upstream policy. So we have more than 100 policy solutions that are going to be tested. The focus is on social protection, understood as any vulnerability across the life cycle, which means that we have a very diverse portfolio. But it's also on leaving no one behind, which is a second part of the Agenda 2030 besides the SDGs, which means that we need to focus on the most vulnerable and really provide assistance to those people that are either most vulnerable or at risk to be most vulnerable. And then with COVID, actually, that changed a lot. We have more than 600 partners across 35 joint programs. They come from government, from private sector, from civil society, grassroots movements, local communities, and the joint programs are led by national stakeholders. So that's about our approach overall. Now, the joint programs were launched just before the COVID happened. So they were already up and running, most of those, and they had infrastructure to react quickly. Being in the area of social protection for the most vulnerable, that actually was a good starting point because this issue, protecting the most vulnerable in the pandemic context, came, to the top of the agenda. Which means that our joint programs became even more relevant than before. However, our joint programs had not provided humanitarian assistance, so they did not provide this health care support like PPEs or something, but they did engage in more systemic, more upstream issues. So we provided the opportunity to everyone to repurpose up to 20% of the budget for COVID-specific activities, and around 1/3 of the portfolio did that. But all joint programs integrated adaptations to ensure that they remain strategic and relevant, and that basically they're not on autopilot, but that they are properly contextualized. Otherwise, they cannot achieve this catalytic effect. So they were still continuing to focus on systemic impact. For instance, starting with a joint position of the government on how you should approach social protection issues during the pandemic, or accelerating the progress on developing social protection policies that are cross-sectoral. And they, of course, prioritize the support to the most vulnerable. SDG acceleration, that's the ultimate goal. The baseline got worse with pandemic, of course, but we still hope that we'll get back on track, and acceleration is even more important than before. And then building back better in terms of not just addressing the immediate effects, but working with the long-term impact of the pandemic. And you have some of the 3 bullet points on what that really means in terms of the design of these interventions. Now, and this is my last slide. Within the 35, and I said it's a very diverse portfolio. We work on anything from children and elderly, youth, disability, women are mainstreamed across the whole portfolio. This is one of our main focuses. We also work on unemployment and, of course, broadening the benefits under social protection coverage. But within that, there's a group of countries, 6 of those, 6 joint programs with more than one country that focus on something very specific, which is usually called shock responsive or adaptive social protection systems, which I'm not going to go into this. I hopefully you have some background knowledge, but basically that means that you're thinking about specific ways to protect the most vulnerable in the times of crisis. That usually was focused on the impact of climate change and natural disasters or food security. But now we have additional aspect, which is the pandemic. So these programs were incorporating the impact of COVID, but also modifying the approach to some extent, because that was meant to address a bit different kind of crisis. But still, the focus is on protecting the most vulnerable in these difficult times. On the slide, you have the link to the fact sheet on all 6 joint programs. You have the map, you have the list of countries. But this fact sheet is already in our virtual booth, so you can check it out. Now, we discussed with our colleagues, and 3 of those I wanted to share the early lessons. So they basically launched in early this year, had COVID. It intensified a lot the work, but at the same time, there's still a lot to be done. So the early lessons learned is what they are going to be presenting to showcase the broader work of the portfolio. Each of those joint programs is very different. So that's going to be also very interesting for you to see. This is the idea. The idea is to really give you sort of a highlight of what's being done. Because even for me on the side of portfolio management, there's so much to digest because things are happening very fast. So I will ask the colleagues to present. And by the way, our joint programs are fully devolved in terms of implementation to the country level. So this is the UN country teams with national partners, government in leadership position who implement those programs. So this is where we really want our investment to be properly contextualized and led by the local stakeholders. So I'll leave the questions that you may have on this introduction to post into the chat, or you can even ask a question in the Q&A more formally. But let's move on to the presentations. So the first presentation will be from Indonesia. And I would like to ask Anissa to give us a short presentation of their experience and lessons learned. Anissa, over to you.
Thank you, Nat. Thank you for also elaborating the global context on our joint partnership. So good morning, good afternoon, and good evening for all participants. Thank you again for joining the side event on lessons from Joint SDG Fund, an integrated approach to COVID-19. It's been a pleasure for me to be here to represent Joint SDG Fund in Indonesia. So this joint partnership in Indonesia is conducted by 4 UN agencies, UNICEF, UNDP, WFP, and also UN OCHA. So for this short presentation, I will elaborate the implementation of our joint SDG Fund and also the government commitment toward shock responsive social protection, or in Indonesia, we call it as adaptive social protection. Before I move to the next slide, I would like to start by giving a context. So, sorry, Nat, probably we can go to the previous one, thanks. Since last year, I think end of last year, the government of Indonesia through the National Development Agency, or Bappenas, is developing a roadmap toward adaptive social protection. So they work with the support from GIZ, and then this roadmap of adaptive social protection is expected to be the reference document for ministries and also other stakeholders to design the policy direction, regulation framework, good practices of Indonesia on adaptive social protection. So through this framework, they are trying to linking the disaster risk reduction, climate change adaptation, and also social protections. Then in March, the president of Indonesia announced the first 2 COVID-19 positive case. The pandemic spread all over the globe. It hits the economic very hard. This quarter, Indonesia entering economic recession. And then the poverty rate was corrected deeply from 9.22% to 9.78% only in the first month when the president announced the COVID. I received the data only today that the government is actually anticipated that the poverty rate by the end of 2020 will reach in 16.7%. So the government respond relatively quickly. So they enlarge and extend the social protection program to respond to COVID. So they expand the existing social protection program. They even also launch a new social protection program, ranging from cash assistance, electricity subsidy, and then subsidy for small medium enterprise for population who earn salary under 5 million rupiah. So those different types of social protection. As of August, we understand that the government own 11 social protection program in response to COVID-19. By September, they have spent about 77% of their social protection program. So in line with the effort from the government, the partnership is also seeing some of the room of improvement. So we start by kind of like identifying the gaps that occurring within this implementation on a social protection program amid COVID-19. So we identified there are 6 steps. So we can move to the next slide. There are 6 steps, especially on the specific program, the extended social protection program for COVID. So we found that there is a need to support the government on impact assessment, because this different social protection program is actually run by different ministries. The biggest two are the Ministries of Social Affairs and also Ministry of Village. So we see the gaps on the impact assessment and the monitoring and evaluation. Another big chunk, another big gap is on the unified database. This is a very fundamental points for social protection, because what we heard from the government that they haven't updated the database since the last 5 years. So the pandemic is really like of accelerating and fostering the commitment of the government to kind of like conduct a piloting on updating the unified database. And then there is also gap on providing a study on innovative financing on social protection. So kind of like expanding other alternative schemes except from the existing one. The 5th one is regarding the adaptive social protection. So we now, the government is still working on the roadmap, but we are currently now supporting some of the milestones from the Ministry of Social Affairs toward adaptive social protection. And last but not least, like what Annette also mentioned, that this program is about leaving no one behind. We need to ensure that the homeless people that have no formal registration, and also people who live and vulnerable to disaster risk and climate risk is also incorporated on the database. So based on these identified gaps, we work on our interventions. Next slide, please. So we conduct studies on innovative financing. This study is actually conducted by, is currently conducted by UNDP to kind of like provide an alternative on funding scheme on social protection. As one of the alternative is through Islamic financing. We also support the Ministry of Village to develop the budget monitoring and analysis for 2 social protection program under the Village Fund on the cash assistance and also cash for work. We also support the Bappenas on the piloting single registries. And then in doing so, we need to make sure that we also provide an innovative approach on this. This is part of the learning that we also take from the past months of implementation. Another thing is to building synergy between cash voucher assistance and adaptive social protection, because adaptive social protection is kind of like new for the government. They are now developing the roadmap, but the cash voucher assistance, there is an existing platform. There's an ongoing working group that led by the government on cash voucher assistance. So we would like to link this cash voucher assistance and adaptive social protection. And another approach is also working on the early warning system. So what we've learned so far on our program implementation, we kind of like note 5 earlier lessons. So first is that we appreciate the government response to social protection amid COVID-19. However, we see this area of improvement, and then on our cooperation with the government, they are very open to kind of like receive our support to strengthen these different gaps, ranging from technical, from coordination and policy, and also from SOP and monitoring and evaluation. Those 4 are different big outputs that we are actually aiming to. The second, Nenad, would you kindly share the last slide? The second lesson is related with the pandemic itself, that we see the COVID-19 is actually a window for policy change. So when the pandemic outbreak, it spread over Indonesia, the government realized that they really need to update the database. So this kind of like a push for the government to update their unified database, and also to kind of like seeing the approach on the social protection in more integrated way. So thinking from coordination to the monitoring, and also on the testing of the SOP. The third one, we cannot also exclude the importance of the subnational level. So on our intervention, we try to ensure that we work on 2-level games. So the first one is at the national level, and then the second one is at the subnational level. So on our intervention, when we conduct or run a study on support the government in developing the budget monitoring, we need to ensure that we also incorporate the capacity building on subnational level, and also to make sure that they actually link with the discussion and narrative at the national level. The third one is the innovation that I described earlier, that we need to ensure as a UN that we propose an innovative approach on our program. So we try to, on different initiatives, we try to promote and advocate to the government the need to kind of like integrating the homeless people without formal registration on the database. And also that one thing that is important is to involve the village process on determining the beneficiaries, because there are some of the top-down and bottom-up approach, and we need to make sure that there's a balance there. The fifth one is that in developing this ASP, there are many development partners working here. There are World Bank supporting the Ministry of Finance, and then us, UN, with the Bappenas and MOSA in particular, and also with GIZ and ADB. So we in Indonesia, we try to maintain this regular meeting with this different development partner to make sure that we are work in synergy and aligned to each other, to make sure that the adaptive social protection can be developed as a platform, as a coordination, as what the time frame from the government, which is early next year. So I think I will stop here, and I will be happy to take your comments and also your questions. Over to you, Ned. Thank you.
Thank you very much, Anissa. And colleagues, you can see that, for instance, this, but almost all other joint programs are very complex. Each of these components that Anissa presented could be a separate project. So there's a lot on the plate, but the idea is really to bring things together and do that in an integrated manner, that you work across different sectors and across different stakeholders. And this is the only way to actually achieve this catalytic effect. Thank you very much, Anissa. There is a question for you in the chat. So in the meantime, maybe you can answer it. There was another question that is basically for all of us, and that will be one of our questions in the Q&A. So let's move on, and I would like to ask Sarah and Christina to give us a short presentation of their own joint program, and maybe just briefly present themselves. They work in a multi-country office, which includes more than one country, and actually works at the regional level as well in a way. So this is another very complex joint program, but the one that really got a lot of traction already from the start. Over to you.
Thanks, Ned. Good morning, everyone. A very early morning from this side of the world, and good afternoon to the rest of you. My name is Christina Dankmeyer. I'm a social policy specialist with UNICEF's Eastern Caribbean Area Office in Barbados, and jointly with my colleague from WFP, Sarah Bailey, we'll take you through some of the key lessons of our multi-country program, which works with the governments of Barbados, St. Lucia, and then also with the Organization of Eastern Caribbean States. We have about 3 million plus the different agency contributions for the 2 years, and we have 5 different agencies working together. So the program is co-led by UNICEF and WFP, jointly with the ILO, UNDP, and UN Women. So to go to the first slide, to give you a bit of the context, the Caribbean is actually considered to be the most indebted region in the world, and its small island development states are highly vulnerable to large-scale shocks. And that doesn't just include climate-related disasters, displacement, but also because many of them really depend on tourism, economic crisis, and as we see now, public health emergencies. Ned, if you can just go to the next slide. Thank you. 1 in 4 people in the region live in poverty, and even more children, 1 in 3. Our joint program has 2 key objectives. So the first one is to expand access to social protection for people in Barbados, St. Lucia, and the OECS towards universality. But the second one is to make social protection more adaptive, and we made this very specific. So to link it to disaster risk management and adapting to climate change to ensure that people can actually prepare and then also access support in crisis. And to be able to give you a very country-specific experience and lessons that are helpful also to the other joint programs here today, we're going to focus our lessons learned on St. Lucia for this specific presentation. Next slide, please. So when COVID-19 hit the Caribbean in late March, it became clear very quickly that quite a large part of the program would have to be refocused. So we reallocated about 18% of the budget for this year. And in St. Lucia, we started by building a solid evidence base, which would be useful beyond just the immediate response. So we did a study on the impact of COVID-19 on women, but then also a broader microsimulation model, which looks at the impact of COVID-19 on household poverty and child poverty, but also looks at the impact of response measures. So trying to figure out what happens in terms of the poverty rates if you actually look at different types of responses. So this can also actually serve to inform the discussion around raising transfer values, also in the longer term, of the key public assistance program in country. This was actually presented yesterday at the Roundtable 14 for those of you who joined that one. And this particular microsimulation model will also inform the policy reform currently ongoing in St. Lucia. So the policy is being reviewed right now by the government in support, with support of the World Bank, which has a policy-based loan in country, and then we're going to look at the legislation review and align that with the policy review. Now, shock responses social protection in action was already included in our initial work plan, but we, rather than piloting different approaches, were kind of thrown in the deep end and just had to do it. So we started by supporting the government in data collection to close some of the gaps in the system and strengthening coherence between the different data systems of the programs. And that then served to support, first of all, a 3-month top-up to families with children with disabilities and in foster care, and also persons living with HIV/AIDS. And in the case of the first group, we actually turned it into sort of a cash plus approach by adding hygiene kits for those families. And secondly, we then supported a 6-month horizontal expansion. This is still going on, of the key public assistance program in country for an additional 1,000 households. And this actually includes almost half of it are households that were already on the waiting list for the program before COVID-19 hit, and additional new households. And this is actually going to build a bridge towards a more permanent expansion that will be supported by the World Bank policy-based loan. And I'm just going to hand it over to my colleague Sarah for the more in-depth lessons learned. Thanks.
Thanks, Christina. Ned, if you could advance to the next slide, please. And I'm Sarah Bailey, Head of Program at the World Food Program here in the Caribbean, the Office for Caribbean Emergency Preparedness and Response. And it's a pleasure to be here. So building on what Christina just presented, The flexibility of the joint program and its focus on progressing towards more adaptive and universal social protection means that these efforts are not so much a pivot, but as Christina described, a refocusing and a tailoring to the evolving priorities of the government and to the stark economic impacts of the pandemic in the Caribbean and on St. Lucia. So COVID-19 has moved social protection even higher up the national agenda, and the joint program has been in a strategic position both to fuel this advocacy, but also to show some concrete results through the actions that Christina described. And the joint program was already geared towards addressing the government to identify gaps in making social protection more adaptive and universal and gender responsive. And what COVID-19 is doing in St. Lucia is it's modifying somewhat and accelerating somewhat the picture of these needs and in some respects the precise nature of the gaps, but moreover, it's an opportunity to close some of these gaps. Data, as mentioned, putting shock responsive social protection into action by expanding programs to reach more people or to provide greater benefits to them. And all of these efforts are going to advance the joint program's objective to strengthen social protection systems to respond to shocks, not just COVID-19 now, but in the future, which is also one of the objectives of the programs. So this is going to yield lessons related to targeting, related to delivery, data management, and also transfer values as just discussed, which will all be extremely relevant for future planning for shocks that may look different or for a deepening of this crisis, which could also occur. And finally, a key component of the joint program support to COVID-19 is linking with other development partners and accelerating the broader social protection reform efforts in St. Lucia. And a strong example of this is that extension of the public assistance program to 1,000 households, which is combining resources from the joint program with fundraising through the UN India Fund or with funding from the UN India Fund, from the World Food Program, from FCDO, and also from ECHO. And as mentioned, this is going to trigger and phase into a permanent expansion through the World Bank funded Human Capital Resilience Project. So therefore connecting people to longer term safety nets, which they, so beyond the life of COVID-19 and beyond the temporary expansion that's being supported. And one of the best people to tell you more about the crucial role of social protection in St. Lucia is Permanent Secretary Velda Joseph from the Ministry of Equity, who along with government representatives from Dominica and Anguilla will be discussing their COVID-19 responses later today inside Event 9, which is convened by WFP and UNICEF. So we hope that you can join us in about 5.5 hours. Thank you, and over to you, Ned.
Thank you very much, Christina and Sarah. And yes, please do join the other side event today, which is going in more depth on the broader region and the issues, again, focusing on shock response social protection. Just to put myself into the shoes of the audience, sometimes when you're not familiar with how these joint programs work, it seems really amazing. And when you hear all different kinds of things that are being addressed. And by the way, as I mentioned, these joint programs were launched only this year. So it's not been even 9 months of implementation. But the idea is really, and the funding is relatively limited, but the idea is really to do it in a way that is inducing systemic change, that you don't really try to do everything, but you try to connect stakeholders, you try to put together pieces, you try to focus on the leverage points where you can induce a larger impact rather than trying to have a huge infrastructure that does everything. So this is really amazing to see, even for me, managing this portfolio, how these joint programs are moving on and managing to produce quick wins and first actual results, even in the first months and even under COVID lockdown. Thank you so much. We are moving to Bolorma and presentation on Mongolia.
Good morning and good afternoon, everyone, and thank you very much. Today, I would like to present about Mongolia Joint Program, which is focused on herders and their shock responsiveness. So we have selected for our joint program herders specifically because according to a study and also the SDG MAPS report, the herders has been identified one of the vulnerable groups, one of the left behind groups on the sustainable development. So therefore we have selected herders, how to extend their social protection, and at the same time how to increase their shock responsiveness, because herders are one of the population group in Mongolia that are affected by the climate change. So please, next slide, Ned. All right, so basically the focus of the Mongolia Joint Program is extension of the social protection and at the same time the shock responsiveness. So I will explain the project from the shock responsiveness side. So basically, in order to increase herders' shock responsiveness, we have 4 approaches which are also interlinked. The first one is that we are trying to extend the coverage of social protection, especially social insurance of herders. According to the statistics, only 15% of herders are covered by social insurance, and social insurance, so therefore, it includes the old age, loss of employability, and etc. So the project is aiming to increase the coverage. The second approach is that we are promoting the livelihood and also the better livelihood and also the income generation of herders. In that sense, we are trying to use the cooperatives, the existing structure, the institutional framework and the structure in Mongolia. The third approach that we are trying to support the herders in shock responsiveness is the social assistance, particularly with the child money program. Mongolia has a universal child money program. And the fourth one is about the climate resistance livestock production, or, the supporting herders to have animal quality, better animal quality, so that we can survive in winter or during the drought time. Please, next slide. So I will just give you, next slide please, and I will just give you a very brief information how we are doing the extension of social insurance. The social insurance, in order to extend the social insurance, we are trying to give the opportunities to all players, all stakeholders of the social insurance to come up with the innovative ideas. Not necessarily it has to be a technological advance, but it can be a very simple change in the ways that we are doing. So this is one thing. The second one is mostly about the peer-to-peer training. Instead of social insurance office promoting the social insurance, we are involving, for example, the herders, the cooperatives, the lone life education centers, even the trade union activists. We are mobilizing to, promote the coverage of the social insurance. And we are also involving non-traditional stakeholders like cooperatives to be part of, to be engaged in the social insurance. Also, in order to promote the better livelihood of herders, because the idea is the herders, if they have a better livelihood, they will have a better income generation, and at the same time, they will have enough income to contribute to the social insurance. That's the idea in the project. So in order to do that, we are also promoting, the herders classes, how to process the animal originated raw materials, and also at the same time, the vocational education and training schools. We are cooperating together and introducing the herders program. Those young people who are trying to become farmers and herders, that we are trying to support. The next slide, please. And the third pillar, the third approach of our project is shock responsive social assistance, and this is basically the child money program. I think the recent study, I think UNICEF and ADB study has also shown that during the shock time, usually the children at the young age of 0 to 5, they have a lifelong negative impact on their development the later years. So I think with the project we have provided in our pilot province, try to test out how child money program top up can really affect the young children to protect them from the shock. So we have piloted that, and due to the COVID situation, the government has released a stimulus package and has increased the child money program from $7 per month to $35 per month. And the project is also now collecting the evidence how to sustainably continue this universal child money program as a tool to shock responsiveness in the country. The fourth approach, not the last, not but least, the fourth approach is about the climate resistant animal production. So animal is for herders. It's the main source of livelihood for all herders. So in order to have, you know, the healthy and quality animals, and also at the same time, this will be a very important for many herders in the country. So in that regard, the joint program is supporting the government to work on this. There are 4 agencies who are working in this joint program. This is the ILO, FAO, UNFPA, and UNICEF. We are working together, and we are also trying to, you know, all of these approaches are also very interlinked. The cooperatives, for example, we are trying to use cooperatives in a social insurance extension. Cooperatives we are trying to use in the livelihood improvement, and also at the same time, the cooperatives, we are trying to use cooperative as a way to respond to shocks, you know, putting efforts together, the herders as jointly. So this is what I would like to explain about the joint program in Mongolia. Thank you. Over to you, Nina.
So just a second. Okay, sorry. So you see, colleagues, these joint programs are really very complex, and we are just lucky to have great colleagues at the country level, and also very committed governments. When we were selecting these joint programs, one of the criteria was whether there is government leadership and whether the government and other partners are really behind this, and are they willing to scale up, including by financing these programs in the future. After all, these are the governments with national stakeholders who are accountable for the delivery of Sustainable Development Goals. UN is there only to help. So we have just a bit more than a quarter of our session. We'll need to have a hard end at exactly 1 hour. So it seems there's been a lot of interest. There are some questions which are specific to a particular country. There is ongoing discussion in the chat on the issue of database in Indonesia. And there are 2 questions in the Q&A, 2 questions in the Q&A, which is about the specific technical issues. Again, referring to Indonesian context. So in terms of our time, I would prefer to leave the technical questions for either being, you know, responded in writing in the chat, or if our colleagues would use some of their time to quickly respond verbally. But I would like us to focus on the questions, 2 questions that were in the chat, which I believe are a bit more relevant for the broader audience. I will ask that question, and then we'll see if we have time for more questions. So I will ask the question, and then I will call on to each of the joint programs to respond, but please respond under 2 minutes to allow time for the other colleagues to respond as well, otherwise we'll be cut off. So the question concerns the coordination. And this is definitely one of the issues that joint programs are certainly meant to address, being joint programs and supporting the broader UN Development System reform. So can you tell us in under 2 minutes, what is your experience about UN coordination? Specifically, do you think that this fund modality enhances coordination and policy coherence in the field? And then in sort of a sub question would be, how do you engage with civil society partners? Because again, we talk mostly about governments, but there are other partners who are involved, and in many of these shock response to social protection interventions, civil society is really an essential stakeholder. So does this modality support UN coordination, and does it support the broader UN policy coherence? And how do you engage with civil society? So under 2 minutes, and please just be very specific, and of course, based on on just early lessons learned, because it is only the first phase of the implementation. So I will go back in the same order to just have a bit more of the dynamics. So I'll go back to Anissa. Please, Anissa, under 2 minutes, can you help us understand how this works in Indonesia? And you can also mention the COVID fund as well, because this is an interesting case.
Yeah, thank you, Nat, and also thank you for the question. So, as far as I understand, this joint partnership is actually the first GP in UN Indonesia. So it's kind of like a learning curve as well for the UN agencies in Indonesia to kind of like understand and work in an effective way on coordination. We're trying our best in maintaining the coordination. So that's why in Indonesia, there is a designated program management unit which serve the all agencies to kind of like coordinate different initiative. And also on one aspect that is very important is on knowledge management and learning, because that is actually one of the key that we need to ensure there is an exchange of learning between UN agencies on this program, because the richness of the program and also the interventions of the program. I hope that answers your question, because it's very specific on the coordination, so I kind of like contextualize that under the GP. As for the civil society, that's a very good question, because currently this GP is also run in parallel with the COVID-19 Multi-Partnership Trust Fund, in which UNICEF, UNDP, WFP, and UN Women is working together to kind of like support the government in enhancing the capacity to respond to COVID, including the capacity of National Task Force for COVID-19, plus promote the digital innovations. So we work with the civil society. Our colleague from UN Women, they have a specific program at the field level to build a portfolio and piloting on business and value chain mechanism by incorporating women and youth to involve on the different production on mass and then afterwards we can kind of like see it as a kind of like pilot to on the value change for COVID-19, which involve women on the program. I hope that answered the questions.
Thank you so much, Anissa. Thank you so much. And this was really interesting. So I'll now go to the MCO Barbados. So Christina and Sarah. And by the way, colleagues, you see that actually this joint program is co-led or co-managed by 2 agencies. So that's probably part of the answer. Over to you.
You made it more difficult for me to answer truthfully now, though. No, but it's, so in general, just to say, it's working really well. One thing for us that is obviously a bit more complicated is the multi-country context, because we do have some of the agencies based in Barbados and then also in Trinidad and Tobago. But given this context, the COVID-19 dynamic hasn't actually changed the interaction all that much, because it's largely virtual in many cases anyway. And so irrespective of all of this, we have monthly regular technical meetings, we have weekly exchanges. So all of that is definitely more than it was before. Maybe also to say in terms of coordinating with the governments, we have country coordinating committees that also meet on a monthly basis, which makes it easier to just draw all the different pieces together, including actually other actors. So in St. Lucia, we have the World Bank regularly joining those meetings. So we also have effects in terms of coordinating more broadly. In Barbados, we have the CODI process, so Social Protection System Assessment, which also then includes IDB and the European Union as actors that are also active supporters in Barbados of social protection. So that all of that is very useful. I think what has changed, though, is that just more agencies are more active in those countries. So previously, some of the agencies might not have worked in one of the country contexts, but that's not necessarily a bad thing either. And then just to say, regarding the question of civil society, so these groups actually have seats in the respective committees, but just to say that given COVID-19, it just has been a lot more difficult to engage both with NGOs on the ground in person, and obviously also with the different beneficiary groups. So that is something that we're hoping to do more next year, just given the difficulties in communicating face to face. And I also saw there was a second question in the chat box specifically for me, so I'm just going to try and do my best to answer that really quickly. The microsimulation model in St. Lucia in terms of the methodology used. So we based it on the Survey of Living Conditions in 2016, and then also took into account the new targeting methodology, which was supported by the World Bank, called SNet 3.0. And the microsimulation model mostly looked at labor supply and labor demand shocks, because the health expenditure shock isn't actually all that big in the Caribbean, because a lot of the islands locked down, and so we didn't actually have that many cases across the region so far. And we looked at both monetary and multidimensional poverty, so also looking at the multidimensional poverty index, looking at long-term employment, youth employment, job qualities, also self-employed people who might have lost their jobs, food security, and also education in terms of school attendance. So to also show what effects there are more broadly on households and children in particular. And then basically modeled 7 different scenarios. So looking at what would happen if you top up amounts for existing beneficiaries, what would happen if you expand to all of those that may be eligible under a new targeting methodology, what would happen if you give transfers to the bottom 25% of the population, the bottom 40%, and what would happen with specific per child transfers. And so that gives you a pretty good picture of all the different options that the government may decide to use in response to COVID-19. Over.
Thank you so much. Mongolia, Bolorma, tell us under 2 minutes, what has been your experience?
Okay, so the 2 questions. The first one about the UN coordination, how it's working, right? So I think this is also the, just like panelists said, this is the first UN joint program. There is a lot to learn. There is a lot of new experiences that we are together try to overcome. I think one of the biggest advantage of the joint program is that we have a very high commitment, for the high level commitment from the government. So because the joint program is under the UN resident coordinator in the country, so we receive very high visibility and a high commitment from the government. And also, especially this is important for non-resident agencies who are participating in the joint program, just for example, for the ILO, I would like to say, and also the joint program enables the UN agencies as well as the government agencies to work closely together at the working level, because we get to know each other. We, on monthly basis, quarterly basis, we meet at the technical working group, not only about the joint, the program activities, but as well as other related activities, interventions we learn from each other, and then we the work together much closer. Another point is the UNRC office. Now we have a full, the UNRC office in a country. We have a communication officer, the coordination officer, etc. These officers are also at the same time mobilized for example, the communication officer in the case for the UN joint program. So this is, I would like to say the first question. The second question about the civil society, because herders are a very unique, the population in a country. Herders, not directly a part of workers' organization, not directly part of the employers' organization. So we are working very closely with the Agriculture Cooperatives Association, and also we are pasture land users group. So the groups, the civil societies that we are working together are very non-traditional partners that we are working together. So they are also part of all the discussion in the technical working group meetings. Thank you. Over to you.
Thank you very much. Thank you very much, colleagues. I will, in interest of time, I will ask you for one more quick question, which is what comes next. Just like 30 seconds. But before that, I would like to tell to our audience that you can find more information. I'm posting the the links into the chat. You can find more information on our website, but also you can, okay, so I shared the information on the website to all panelists, and then also this is where I'm just sharing this link, this is where our virtual expo booth for the conference is. And by the way, please do join the next session, which is going to be very interesting just after this one. But before we close, I would like to ask each of the panelists to give us, basically, we have 30 seconds, but exactly, you know, otherwise we'll be cut. 30 seconds just to give us one point of what is the most important thing that comes next. So just give us that one point as food for thinking, and then the audience may always get back to you, engage, you know, send you an email or engage through the Joint SDG Fund Secretariat and get more information. So let me start from the middle. Christina and Sarah, what comes next? What's the biggest thing, challenge or opportunity that comes next for the program? 30 seconds.
Thank you. So it's building and learning on these experiences and the flexibility that we're going through in response to COVID-19 with our government partners and with the OECS. And so it's looking at how we can do this to hone and accelerate the overall goals of moving towards more adaptive and universal social protection in the Eastern Caribbean and Barbados and the OECS. Thank you. And St. Lucia.
Thank you. Anissa?
I think for Joint SDG Fund Indonesia, the big opportunity comes in a line is the roadmap for adaptive social protection, because that's going to be the main reference document for the government to kind of like building the policy and legal framework and also fiscal space for adaptive social protection. And then in which we can bring the experience from COVID-19 pandemic and other experience within this, this discussion under this policy framework. Thank you.
Thank you so much. Balarma?
I just say a few words. For our joint program, the next step is promote the innovative ideas, the creativeness, and the joint work together. And then implementation, and we have to demonstrate the government. We have to demonstrate together so that we can really change the lives of people in the country.
Thank you so much, colleagues. I think it was really informative even for me. I mean, you are on daily basis involved in the implementation, so this is always a great opportunity even for me to hear the most recent updates. I hope this was useful for the audience as well. As mentioned, you can reach out to the colleagues whenever you need. There is more information in our virtual expo booth. There is also fact sheet on other joint programs that are involved in this area of shock response social protection. Website, there's a map, you click on country, you get more information. You can even see the whole joint program document. So please, let's continue this conversation. And colleagues from the 3 joint programs keep doing the great work, and we'll also have this kind of exchange continued both internally and sharing with the broader audience. Thank you very much, everyone. This was a great opportunity, and please do join the next session if you have the time. Over.